corticosteroids work in inflammatory disease. If a person is having a severe allergic reaction and they get treated with prednisone, it can turn off the allergic reaction. But what happens if you give prednisone indefinitely? This is bad, right? It starts to thin the bones. Wounds stop healing. The skin breaks down. Not a good thing. So what are safer ways to lower NF-kappa B? One is eating less. Simply eating less decreases inflammation in the body. Calorie restriction. Fish oil, I've already mentioned. EPA and DHA can both lower NF-kappa B. Alpha-lipoic acid, an antioxidant, can lower NF-kappa B. A very, very useful nutrient. Alpha-lipoic acid can also be very helpful for treatment of diabetes, especially for neuropathy. N-acetylcysteine. N-acetylcysteine is best known as an amino acid that's used to make glutathione in the body. It's an excellent detoxifier and a very good immune regulator. Other antioxidants are also helpful. Vitamin C, vitamin E. These can all lower NF-kappa B without turning it off. We don't want to turn it off. We only want to decrease it. A number of herbal medicines have now been shown to work by lowering NF-kappa B. We used to think many of these herbs worked because they inhibited the COX enzyme. But it turns out the herbs are working by acting on DNA directly, by preventing the DNA from getting activated by NF-kappa B. Quercetin, I've already mentioned, is an excellent anti-inflammatory, not just an anti-allergy. Grapeseed polyphenols. Soybean. It turns out soybean is very anti-inflammatory, especially the chemicals in soy called isoflavones. Resveratrol, which is found in red wine, also an anti-inflammatory. And one of my favorites is turmeric, which is the source of curcumin, highly anti-inflammatory. Many studies have shown that combining curcumin or turmeric with green tea work together in a very synergistic fashion to act as anti-inflammatories. Pomegranate juice from the Mediterranean, a very powerful, very, very powerful anti-inflammatory. And a chemical called anantabine, which, interestingly enough, comes from tobacco. This is a surprise, but there are some chemicals in tobacco that appear to be healthy. So I've talked about signal transduction and how information gets from the outside world to the inside of the cell to turn on NF-kappa B, and that results in the release of autocoids and cytokines. Let's look at the big picture of the innate immune system versus the adaptive immune system. Most of what I've been talking about occurs in the innate immune system. The innate immune system requires no prior exposure to the bacteria. But the acquired immune system is the part of the immune system that is involved when you give a vaccination. When you immunize someone, then that prior exposure primes the immune system, so if the child has been vaccinated against measles virus and then they get exposed to the virus, they already know what to do. The innate immune system does not require prior exposure. And the reason it can do this is because the innate immune system already has a program that looks for certain structures, certain three-dimensional structures. And when it sees those structures, it knows it's time to get activated. So I mentioned an injury will turn on a macrophage and a neutrophil, and they will start to make free radicals. Superoxide, hydroxyl radical, and that's like pouring the oil or pouring the bleach on the enemy. It damages the bacteria, hopefully kills the bacteria, but it can also damage tissue. That's why it's very important that we eat a diet that's rich in antioxidants, especially plant-based antioxidants, like tomatoes, like drinking green tea, like eating curry or broccoli, other vegetables. Those are rich in antioxidants. They protect our tissues so that when an inflammatory trigger comes along, we don't get too much damage to those tissues. The innate immune cells are what's called sentinels. Most of the time, they are asleep. They are dormant. They're not doing anything. They're hanging out in the tissue, in the nose, in the skin. The cells that I'm talking about are dendritic cells, macrophages, and melanocytes, which are pigment-producing cells in the skin. What activates these cells? Well, I've already talked about signal transduction. These cells are activated by exposure to certain structures called PAMPs, pathogen-associated molecular patterns, or damage-associated molecular patterns. Here is the cell surface, and here is the receptor, and it's seeing this pathogen-associated molecular pattern. If this is an innate immune cell, it sees the pattern, and it says, this is time to get activated. This is a stranger. But it doesn't react fully. It only starts to get stimulated. It needs a second signal to get fully turned on, and that second signal is a damage signal. If you cut the tissue and you open up the cells, what is inside the cells? DNA, mitochondria, ATP. So if there's ATP or fragments of mitochondria in the bloodstream, and the immune cell sees that and also sees these pathogen-associated molecular patterns, it says, aha, foreigner, stranger, and danger, signs of damage. So damage means dangerous stranger. And that's what gets it activated. What are these pathogen-associated molecular patterns? Well, they're found in fungi. They're found in bacteria. Dr. Hanaway mentioned lipopolysaccharide, LPS, one of the most prevalent structures that's found in our intestines, also called endotoxin. Every time we eat, a little bit of endotoxin crosses the barrier of the gut and goes into our bloodstream. And if the person is already unwell, if they already have inflammation, what they notice is every time they eat, they feel not so good. They feel a little bit sicker. Every time they eat, no matter what they eat, it's because these pathogen patterns, lipopolysaccharide, are getting into the bloodstream. This is a result of leaky gut, impaired permeability, or excessive permeability. And as Dr. Hanaway said, in functional medicine, we have a number of protocols using glutamine and probiotics to try to heal that. All I'm saying is that if good fences make good neighbors, and the fence gets broken, the barrier is broken, it allows these bacteria that are normally on the surface of our gut, these pathogen patterns, to come into the bloodstream and activate the immune response. Viruses can do the same thing. So this is how the innate immune system responds to the outside world. It looks for pathogen-associated molecular patterns. These patterns are only found in bacteria, viruses, and fungi. They are not found in vertebrates. So it's an immediate way for immune cells to say, that is not part of me. That is something foreign. That is different. Now, this is something that I have found fascinating and have studied for many years. There are certain fungi that are very, very good for our immune system, such as shiitake mushrooms. I had the other night for dinner bamboo fungus, certain kind of medicinal yeast, maitake mushroom, reishi mushroom, that we have known about for thousands of years as being very beneficial to the immune system. How do these mushrooms work? The mushrooms have similar structures in them that look a little bit like bacteria. When our innate immune cells see that structure, it wakes them up. So they were asleep and they wake up and now they're ready, right? But they're not inflamed. They're not overactivated. They've only gone from being asleep to being awake. And that's what medicinal mushrooms appear to do. They wake up our immune cells, but they don't make them angry. And this is a very useful thing to take advantage of. So I use medicinal mushrooms in my patients quite regularly. I think they're very, very helpful, and I've never seen side effects. They are especially useful for people with recurrent infection and for people with cancer. There is also research that medicinal mushrooms can be helpful for certain autoimmune diseases depending on the mushroom. So if you understand this molecular mechanism, then it makes sense how something like a mushroom or aloe vera, the plant, could work to prime the innate immune system. This is a macrophage, an innate immune cell, and it's eating a yeast, Candida albicans. When that macrophage immune cell wraps around the yeast, its cell surface receptors are binding to those molecular structures I talked about. Only this time, those structures are highly inflammatory. Candida albicans and similar kinds of yeast don't need that second signal that says this is dangerous. They already know. So there's a difference between this kind of yeast and other kinds of yeast that have been shown to be beneficial, such as the yeast that's found in beer or the yeast that's found in bread. Saccharomyces is quite beneficial. But Candida albicans is highly inflammatory. And that macrophage, when it eats the Candida albicans, begins to release interleukin 1, interleukin 6, TNF alpha, and that could cause C-reactive protein to go up and predispose a person to heart disease or other inflammatory disorders. So let's just summarize what some of the triggers would be for turning on the innate immune system. All kinds of trauma. Mechanical trauma, just a simple cut. A chemical burn. A sunburn, being in the sun too long. Certain kinds of electromagnetic radiation. And what does this traumatic experience do? The trauma releases the inside of the cell, the nuclear debris, DNA, mitochondrial fragments, ATP. These are all danger signals. So if you put together a danger signal with a pathogen structure, a PAMP, or certain foods, which I've mentioned several times now, advanced glycosylation end products. These foods occur when certain sugars or proteins are cooked at high temperature. An example of that would be a donut, which is a fried dough. Carbohydrate that's fried, that's cooked at high temperature, and then sugar added to that, is highly inflammatory. Why is it highly inflammatory? Because innate immune cells see that structure as if it was a bacteria. Then the innate immune cell says, that person ate a donut, but it looks like they're under attack by bacteria. And I better wake up and get stimulated and start making inflammatory cytokines. What happens if a person eats that kind of food every day, fried dough, every single day of their life, year after year after year? It sets them up. It fills the body with inflammation. Just as if they had a chronic bacterial infection or a chronic yeast infection. It's just as bad. What else can contribute? Certain heavy metals, as I've mentioned, and organic chemicals, which I'll talk about in some detail. Free radicals, overproduction of bleach or hydrogen peroxide in the system can damage tissue. We all produce free radicals as the price of breathing. We live in an environment full of oxygen. We need oxygen. So we breathe in the oxygen, but then we make free radicals as a result of that oxygen. Our bodies are rusting inside. If we don't have adequate antioxidants in our diet, we have nothing to protect ourselves against that rusting. So our tissues rust and break down and become chronically inflamed. The largest source of exposure we have to inflammatory triggers is the mucosal surfaces, the nose, the mouth, and the gut. And that's why we had Dr. Hanaway give an entire lecture on the gut, because that's where our biggest source of exposure is. The skin is a pretty close second. So it's very important to have intact, healthy skin. If the skin breaks down, that allows bacteria to get into the bloodstream and set off an inflammatory response. So I talked about the difference between acute inflammation, which is almost always beneficial. You step on a nail, you want the body to get it out. You breathe in some dust, you want to sneeze it out or cough it out. That's beneficial. If you cut yourself, you want it to get swollen. You want it to be a little bit painful. It tells you an injury has occurred. People that cannot feel pain, such as diabetics, who cannot feel pain in their feet, are prone to getting ulcers in their feet. And those ulcers can get infected, which can lead to serious problems such as amputation of the foot. So we need all of these things with acute inflammation. That's why it's considered to be adaptive. It's a good thing. In contrast, chronic inflammation, where these cytokines are being made all the time, where C-reactive protein is elevated day in, day out for years, indicating overproduction of interleukin-6. This is always detrimental. There is nothing beneficial about chronic inflammation. Chronic inflammation builds on itself. The longer it's there, the more it tends to make itself happen. It keeps building and building and building, which means that it's very hard to turn off initially. This is why if we treat someone with rheumatoid arthritis, we have to use regular pharmaceutical medicine in the beginning to try to block the process. But then we step in with functional medicine, with the fish oil and similar kinds of things. The curcumin, boswellia is an excellent herb for joint aches. That's going to take longer to work. We need both types of medicine to be effective with a chronic inflammatory disease because it's going on and on and on without stopping. With chronic inflammation, you always get destruction of tissue. So it's never a good thing. Examples of chronic inflammatory disorders. Well, you could say that any chronic disease is an inflammatory disorder. You name it. Diabetes, inflammatory bowel disease, cancer, schizophrenia, autoimmune disorders of any type are all disorders in which NF-kappa B is chronically activated. And we call these itis, rheumatoid arthritis. So why do we have an epidemic of chronic inflammatory disease? Is it because we have a lot more bad genes than we ever had before? I don't think so. I don't think we suddenly have more people with inflammatory genes than we ever had in the past. More likely, it's because we eat too many foods that are rich in arachidonic acid, not enough foods that have omega-3 fats, too many glycating foods. By that I mean foods with sugars that stick to proteins and form advanced glycosylation end products. And then a lack of antioxidant phytochemicals. I think it is primarily the antioxidants in plants that are beneficial, not the chemical antioxidants like vitamin C and vitamin E. Those are fine, but the most beneficial antioxidants for preventing inflammation are the ones. This is a summary of what I've been saying that's from the journal Science, published in 2002. It says that inflammation is basically a molecular phenomenon. If the immune cells are activated to become inflamed, it's always because of exposure to a molecular signal. That signal interacts with the receptor on the membrane. That then activates kinases, transcription factors such as NF-kappa B, and then the genes will be activated to create an inflammatory response. My point with this slide is that depending on the individual, the same triggers, the same foods, the same infections can lead to cancer, heart disease, asthma, multiple sclerosis, rheumatoid arthritis, depression, or ADD. Because it's the same structure, the same mechanism inside of the cell that's being activated. But every individual is a little bit different. So for one person, eating a certain food will lead to one problem. For another person, eating that food will lead to an entirely different problem. Obviously, the solution is to change the diet. As you'll see on the right, eating phytochemicals, plant-based chemicals, antioxidants, and omega-3 fats will dampen the process, will help turn it off. But omega-6 fats, arachidonic acid, and oxidants, burning material, which we'll talk about in some detail, cigarette smoke, charred meat, can all activate it and make the inflammatory process worse. From conventional medicine, the perspective is that we treat way downstream. We don't even look at what brought it all on in the first place. We treat way down here. And what do we treat with? Steroids, non-steroidal anti-inflammatory drugs, leukotriene inhibitors, DMARDs, disease-modifying anti-rheumatic drugs like methotrexate, very powerful drugs that turn off the immune system. These drugs can come in handy for a person that has serious pain or serious inflammation, but they're not the solution for the long term. And this is simply a diagram of where the drugs work on these pathways, but in contrast, you can use natural products to affect all of the same enzymes. You can use EPA and DHA from fish oil and doses of 1 to 4 grams a day, typically, to block production of inflammatory prostaglandins. You can use GLA, gamma-linolenic acid, which is found in borage oil, black currant seed oil, and in human breast milk, as a very potent anti-inflammatory. Niacinamide, not niacin, but niacinamide, which is related to niacin, is a very potent anti-inflammatory when used in doses of 2 to 4 to 5 grams per day. Alpha-lipoic acid, I've mentioned already. N-acetylcysteine, doses of 500 to 3,000 milligrams a day. These are all part of your armamentarium. These are things that you can use long-term in people with chronic inflammatory diseases. And again, it doesn't really matter which type of disease. So you might be treating asthma exactly the same way you're treating cancer. Exactly the same way that you're treating rheumatoid arthritis. Why? Because you're treating the same cellular pathways. The same cellular pathways. Probiotics, Dr. Hanaway talked about, can be very useful because they send signals to the innate immune cells in the gut, saying everything is fine, everything is friendly, we have harmony. So if the immune cells think there is a lack of harmony, probiotics help restore harmony when used long term. Other herbs that I like a lot, willow bark is the original source of the chemical that was used to make aspirin. Willow bark should be used a lot more, except that if you make a tea of willow bark, it's not quite strong enough. You really need concentrated willow bark. A very potent anti-inflammatory. It's also useful for acute pain, for joint aches, for headaches. But you need to use a concentrated form of willow. The dose, 240 to 960 milligrams a day. Quercetin I've mentioned, boswellia. Curcumin is really an excellent anti-inflammatory, often combined with boswellia, with white willow bark. These are all very, very safe substances that can be used for years on end. Many of them help prevent cancer. So not only are they treating an illness, they're helping to prevent another illness by decreasing the inflammatory response. Licorice root. Pardon if I have this pronunciation down. Is it gankao? Gankao? The licorice is used in traditional Chinese medicine, in almost every traditional Chinese medicine. In the U.S., it is in the American Medical Association Handbook of Poisonous Plants. I think it's a very useful herb. In the West, the only thing they think about it is that it causes high blood pressure. And that's the end of the story. But it's one of the most potent anti-inflammatory herbs there is. Very, very useful. Other herbs to mention in closing, Chinese skullcap, Scutellaria bicalensis, also called scoot. Very good for allergies, very good for cancer. Ginger root, another very potent anti-inflammatory. Milk thistle, often thought of for liver disease, but has been shown to block the LOX enzyme, so it can be helpful for joint pains. Devil's claw for joint pains. Ginkgo biloba, often thought of as the memory pill, but actually better for asthma, better for lung conditions. So, in closing, what have I told you? Inflammation is a normal physiologic attempt to defend the body against a foreign invader and to repair the body when it's been injured. It's normal, it's essential for life. We don't want to turn it off. We want it to work well, but we don't want it to go overboard. How do we activate the immune response? From trauma, from infection, toxins, or poor diet? This is a theme you will hear over and over again for the next 5 days. If you understand that trauma, infection, toxins, and foods are the primary agents, the primary things that can turn on the immune response and should be avoided, then you'll make a lot of progress in working with your patients. Most chronic diseases are linked to excessive inflammation. So how do we have that? When the injury is ongoing, eating the same bad foods day in, day out. Or a chronic infection in the gut, chronic yeast infection in the gut, or a chronic skin infection, day in, day out, same exposure. So if a person comes to see you with an inflammatory disease, then you have to ask, what keeps triggering this person's immune system? You have to ask that question if you want to solve the problem. Drugs focus on the downstream effects. Drugs only look at all those autocoids and cytokines and chemicals that are being released and say, how can we turn that off? Functional medicine works upstream to keep it from happening in the first place. It's a much more rational way of doing things. So ultimately, we want to dampen inflammation by avoiding the triggers and by modulating the mediators with lifestyle changes. Simply having a person either eat more fish or take omega-3 fatty acids, eat less, as I mentioned, which decreases NF-kappa B, eat less sugar, and, when appropriate, to use nutraceuticals such as the ones that I've outlined. So, thank you very much.